like write down your questions and your feelings, how you
Ahead
feel
of time.
ahead of
Mhm.
time, or even like when you find out, you may not think of everything then,
Oh,
but then there may be like once you've kind of had a chance to process this, you may have other questions. I write down questions too. So write down, like have a piece of paper or something. And when a question comes, write it down so that then when you go back, you can just rely on anything that you think about that you may not have thought about at the time. Because sometimes as you process it, things come up and you're not going to remember when you go back. So I really encourage people, write down everything that you think, every question that you have, whatever it didn't make sense. I thought I heard this. Is this correct? Write it down and literally take that with you, to the doctor's office, to the
that's
doctor,
good.
to appointments, so that you can kind of and just go through your list. I mean, I do that and have done that. So I think that's important. And then give yourself permission to feel how you feel. I mean,
Welcome to Get Real with Alexis Jones. On this podcast, we'll dive into real relationships with real people guided by the wisdom and perspective of some of the most seasoned voices in our community, our beloved seniors. Each week, we'll unpack the joys, challenges, and lessons learned about love, family, friendship, and everything in between. This is a space for heartfelt conversations, eye-opening truths, and powerful stories that will inspire and challenge the way you think about relationships. We're keeping it honest, unfiltered, and deeply meaningful. So settle in and let's get ready to get real. Let's jump in.
and just decided, with everything, that was going on, I had missed a year of getting my mammogram. And so I was like, oh, I probably should go get a mammogram. Because I was kind of thinking with everything I've just been through, I really got to make sure I'm staying on top of all these things. So I went for a routine mammogram around July. It's actually July 2016. Went and got a routine mammogram, and then they called me back. They, how they call you back with the results of the mammogram. So they called me back, um, and they tried calling me for a couple days, and I was just like, they probably just want to tell me it's normal. So they finally reached me, and they saw something suspicious on my mammogram, and they wanted me to come back and do a biopsy. And so I was like, okay, whatever. So went and they did an ultrasound and a biopsy, and it turned out I had breast cancer.
My,
Is that the craziest
it's
thing?
crazy.
So I had breast cancer in the right breast. And it's interesting because I was at Piedmont, is where I had been going getting my mammograms. And it just so happened, so that's where they diagnosed the breast cancer. And so they were going to refer me to a Piedmont breast oncologist, but it just so happened there was some issue with the insurance company. So they gave me the name of some oncologists at Emory. And so I just kind of looked them up. And then at that point, I got to find a doctor, got to manage this. And so the doctor that I found at Emory um, was able to see me right away. And it turns out that that oncologist, and I didn't know this ahead of time, was the same oncologist that treated one of my best friends. And so, when I told her what was going on, so she's like, who's your doctor? And I told her, she's like, oh my gosh, that's my doctor. He's so wonderful. And so I just felt like, okay, I'm in the right place. This is meant to be. So I got referred to Emory. And so that was probably August by the time that was straightened out with the insurance company. And so I had a mastectomy. I had my right breast removed, and then I underwent 6 rounds of chemotherapy. And then because of, the care, like the the receptor positivity of the tumor, I ended up having to have infusions for like a total of a year. So I had chemo for 6 months and then this infusion for a year.
Was there ever a time that you were just afraid?
I think the cancer diagnosis, I was afraid. I think that's the thing because I think having a cancer diagnosis is kind of the thing that most people are afraid of. I think the aneurysm, it didn't scare me because I didn't expect it. If I had known I was walking around with this aneurysm that could rupture, that would have scared me because the outcome for most people that have a ruptured aneurysm is they don't survive it. Or if they do survive it, they survive and they have residual deficits, like something, either speech or vision, or they can't walk or whatever. And so for me to have come through that, one, survived it, and two, to have no residual deficits, I take that as a miracle.
Yeah,
I really do.
absolutely.
It just so happened that the way my cancer was growing was in such a way that they couldn't do a lumpectomy because they couldn't get it out. It was kind of tracking in an unusual way. And it was invading, but they look at your lymph nodes and that really tells you the degree of spread. So I had a tiny bit of cancer in one of 24 lymph nodes that they took out of, the axillary of my underarm. And so I was a very early stage. And so once I knew that, then it was a little less scary to me because it was caught early and we were pretty aggressive with the treatment. We did the chemo and all. And I think that then it was kind of like, okay, we got that early. I think had it been a later diagnosis or more extensive, or if there had been metastasis, I think that would have been really scary because that scares me. And I think the cancer, I do think about it, not all the time, but sometimes, and I just hope it never comes back. I'm almost 2016, I'm 10 years out. Actually, it's 10 years this year, this January. Thank you. Chemotherapy was one of the hardest things I've ever done. It was really difficult. And it's interesting
How
because
long did you have to do that?
I did 6 rounds of it. And so we started chemo in September and I did it through January. So I think like the end of January, beginning of February was my last round of chemo.
Did you lose your hair?
Every bit of it.
Did you?
Yeah, and I had been growing locks for about almost 10 years. And so I had locks that were like down to, oh my gosh, I loved my locks too. I will have to show you, but I had locks that were down to here, loved my locks. And so I can remember when I started the chemo, that was like, I said, oh my gosh, I'm going to lose my locks. And it was the weirdest thing, the way your hair comes out with chemo, because you literally, like, I could just lift up the locks and it would just be smooth. It was like literally, I could almost just push them off my head. It's like roots and all. They just come out. And so I remember it doesn't happen right away, but after a couple of rounds. And so they started coming off. And so I remember I was so emotional. And so my husband was just like, let's just cut it off. And I was like, okay. So we literally, I remember sitting there and he got his clippers and we just shaved them off, and so that was really hard. I actually saved them. I actually I saved them because I was like, wow. So that was really hard.
There's something about a woman in her hair, no matter whether it's long or short, it's her crown.
Yeah.
And you lose your crown, like, oh my goodness.
Yeah. And I remember when I went back to work, I debated, like, I went and got fitted for what was supposed to be like a really expensive wig, but it's like I didn't like the way it looked. I tried, wearing hats and scarves. And then finally I just said, it is what it is.
You just rocked it.
I rocked it bald.
Oh, right.
And I remember when I went back to work. Yeah, I went back to work. And that was really difficult because some people knew, not everybody knew why I had been out. And so when I walked back in, I just walked in like with no hair. And everybody again was really supportive. My students, like some didn't know and some thought I just decided to cut off my locks. And I said, no, that's not quite what happened. But everybody was really supportive. And I've been wearing my hair short since then. I just, once it started to grow in, I just, and then I was really, because then I started reading stuff, that there's a really tiny percentage of people whose hair never grows back from chemo. And I was just like, oh, please just let it grow back. And then the other thing is like, I don't dye my hair. So I don't have, I didn't have, like, I got more gray now than I did. But then I thought, it's probably going to all come back white. All the stress I've been under. I said, and so I was just like, whatever. But it didn't come back, white. And so those were like little wins that I was so happy. Like, oh my gosh, it grew back. I still don't think that the front, parts of it never grew back the way it was before chemo, but I'm just happy to have it on my head.
Absolutely. Absolutely.
Yeah.
I want to talk to you about, oh my goodness, I'm so thankful that you survived all that you've been through.
And I told you the last thing was my back surgery.
No.
That was the last thing, even after all of that.
When
and that was in
that?
2021.
That was just a few years ago.
Yeah. And so, again, I just started having like problems like with walking and pain in my legs. And I thought it was because of all the surgery I've had on my hips. I thought that that's what it was. And then excruciating, like unimaginable back pain. And then went to a neurologist, a neurosurgeon, and ended up, I had severe spinal stenosis that just developed. I mean, it's just kind of one of those things that developed. And so in 2021, I had to have back surgery where they actually had to take out the back part of my vertebrae in that lower part to relieve the pressure. And so I had that back surgery, which was a horrible surgery, but then recovered from that. So that was the last
How
thing.
long was that recovery?
It was probably in all a total of about a year. Like the actual surgery, I had that done. And then for like 6 to 8 weeks, literally, you couldn't turn or do anything. You couldn't bend and stuff like that. And then after about 6 to 8 weeks, then I did physical therapy for some months. And then just gradually, I'd say and then it was like better, but I could still feel residual things in my legs. And probably after about a year, I was completely recovered from that.
She is working out. She is working out after all of that.
And love walking and working out.
That's amazing. I want to ask you some questions that I think our listeners might be
after all of that.
After all, I want you to help us navigate the medical community. One of the things that I'm holding on to is how much support you had and how important that was.
I counted as, a blessing that I have people, with me and to walk with me and to support me in that.
What does good care feel like from a patient's perspective?
It feels good.
What does it look like?
So, one of the things that I'll say is that I think you have to pay attention to your own intuition about a situation and about the provider of that care. And you should feel like this is someone that you can trust. You can, because in other relationships, you rely on that intuition about someone.
Right.
Is this somebody I can trust with? They tell me, how does this person make me feel when I'm with it? Is there something about this person that makes me hesitant or uncomfortable? And I think sometimes when we go into a healthcare setting because we feel like it's not an even playing field or the dynamics change, or this is somebody that has this authority and this knowledge, we throw all that out the window. Yeah. And so we don't rely on our intuition, but you should have those same feelings about, even more so, about a person whose hands you are putting your life and your well-being in. And so I think intuition is important, and it's important to pay attention
and we
to that.
often ignore that.
We
Because
ignore
as you
it.
say, you're a medical professional. I'm just going to put my care into your hands,
Right.
even though something doesn't feel right.
Right. Pay
Or
attention to that.
Pay
Pay
attention.
attention to that, because you should
Really
feel that
good.
you can trust and feel good about this person whose hands you are putting your life and your care in. And so I think That's really important. And I think going all the way back to like with my mom, when we went to that one oncologist, and this was, they were just very matter of fact, we just need to remove everything and she needs chemotherapy. That did not feel good. It did not feel right. And my mom listened to that and she said no, and some people would have been like, well, that's the doctor. That's what, which would have been life changing.
Yes.
To do that.
Yes. Well, one big life change.
Erica, right.
Hi, Erica.
Right. So I think that I learned that from my mom, because she was because I didn't know, but my mom was like, no.
You didn't know, and you were ill.
Yeah.
That's the other thing. It's hard to advocate for yourself when you're ill.
Right.
The fight is not there. You might think it, but actually being able to advocate for yourself becomes much more difficult. You need a fighter with you.
You do.
You need another pair of ears who hears differently than you do at that time.
Right.
What are some questions that patients should never be afraid to ask the doctor?
One of the things, in particular, doctors should not be offended by this. Like one of the things, if somebody's about to put scalpel to me and operate on me, I really want to know, how many of these have you done?
We don't ask that question.
Right. Like, how many of these have you done? And even if you want to ask, like in a patient like me, what's the expected outcome? Like, how many of these have been successful? So you get to ask those questions, and they should be willing to tell you that. They should be able to say, I've done 500 of these. I've done 20 of these.
I'm not doing this until I get a chance to talk to the doctor. I need to feel confident that I want to go through with this.
Because trust me, once you sign that, heaven forbid something doesn't go the way you expect, they're going to go back, but you signed it. And you're going to be like, well, I didn't. Well, why didn't you ask?
Right.
So you better believe they're going to rely on that. So you get to advocate for yourself and have the same expectation that what I'm signing reflects my understanding.
Yes, and we have a right to fully understand.
That's what that document that you're signing is saying.
That's what it's saying.
You fully understand and that you've had the opportunity to ask questions. Yes. And if you don't take advantage of that, they're going to be like, well, you signed this. You get to do that.
You get to do that.
And my thing is any physician or healthcare provider that feels offended or gets angry because you are advocating for yourself or asking questions, that is a red flag. That's not someone that you want to entrust your care to.
So it is important to feel comfortable and have all your questions answered, even if you have to delay that procedure.
Absolutely.
So what is, this is important. How could someone advocate for themselves without feeling the medical staff or the doctor feeling like you were rude or intimidating?
It is important, like in any situation, how you approach that person.
Yeah.
So respectfully, professionally. And, you could say, I just have some questions, or I'm unsure of this. If you could explain this to me, so I think it's how you come into it, because I think, physicians and healthcare providers are human too.
Yes.
And so if you come in there all so much, then that's going to make them defensive.
Right.
Don't want that. You don't want that, because that doesn't accomplish anything for anyone. But I think coming in and just coming from the perspective of, well, I have some questions or some things I'm not sure about, I think that just is important, how you approach them. But I think it's just treating them with the same level of respect you want to be treated.
Absolutely.
With. I think it's a mutual respect. I mean, speak to them the way you want to be spoken to, so I think it's the same,
I agree. Sometimes when we go to the doctor, we have a issue. Maybe we're having stomach pain or something that we don't know the cause of, and we go to the doctor and they can't find anything. What should we do? They say, well, everything looks normal. We can't find anything. Usually what happens is they prescribe a medication. I know you have to take medication for something. What bothers me is, you want to give him medication, but you don't really know what's going on. How far should we take that?
That's a really good
Because I
question.
know that doctors don't always know.
Mhm.
What do we do?
Oh, I think that's a great question. I think it's important, like when you think like from a physician's perspective, like when I go to the doctor, one of the things, because I don't always like every doctor's office that I walk into, especially like if it's a new physician, I don't tell them I'm a doctor. Like it's on my medical record, like where I work, but I don't tell them I'm a doctor because I just want to see how they respond to me, not knowing that I'm a physician. So that's kind of like my thing. That's not like the first thing I walk into the room saying. But I think one of the things that they're always struck with, and I think it kind of may give me away, is I can give very detailed explanations about what's going on with me. And so even when they don't know initially, they're always like, wow, that was a really great explanation of it. And I think that's important because I think the more information that you can give your healthcare provider, the better job they can do trying to figure out what's going on. And so
What does that information look like?
So if you're going there and say it's like, oh gosh, my stomach hurts. If I just go there and say, oh, my stomach hurts, there are a lot of things that can cause your stomach to hurt. And so I think the more and sometimes, like if you're going in an emergent situation, you just rushed in and they're just going to do a lot of diagnostic tests. But if this is something that's kind of going on, I think the more you really think about how do I explain this to someone before you go or while it's happening, then you know that that's more information I can give my doctor. So for example, if I'm going and it's like, oh, I got this stomach ache and some days I have it, some days I don't. Well, when do I have it? Every time I eat, I get a stomach ache. And then a couple hours after I finish, it gets better. Every time I eat fried foods, I get the stomach ache. But so the more you think about what does it feel like? It's a stabbing pain, or I get it and then I feel nauseated, or I get it but as soon as I go to the bathroom, like when I get it, it makes me feel like I have to have a bathroom, and then I go to the bathroom and I feel better. Those are the kinds of things that the more you can think about, how do I explain this is it a sharp pain? Like, does it feel like somebody's stabbing? Is it a dull pain?
I'm laughing because this happened to me recently. So what kind of pain is it? Is it sharp? Is it stabbing? I don't know. I mean, it just hurts.
And then when you can characterize the pain, is it right here? Is it right here?
I said, but sometimes I feel nauseous. She said, well, nausea is usually here. I said, what's part of it? So thank you.
So really thinking about like what is that pain? Because when you can go to your doctor and say, it's usually after I eat fried foods and it's right here, and then when I go to the bathroom, it feels better. Or if you take something and it makes it feel better, like I take Pepto-Bismol and that makes. The more you think about that, the more information you can give your healthcare provider, the better job they can do of kind of sorting through. Because if you just say my stomach hurts, I'm here to tell you that can be so many things. But the more, and then they add the physical exam and then, what they find. And then that helps them decide, okay, what test might I need to run? All of that really weighs into them being able to provide the best diagnosis.
That's good. I'm so glad you shared that. Well, we talked about most of this. I do want to ask you this as we wind up. 2 questions. What do you wish every patient knew before walking into a doctor's office? If you could speak directly to someone newly diagnosed and overwhelmed about that diagnosis, what would you tell them?
Wow. I would say, I think if you're able to find someone that can kind of walk the journey with you, a friend, a family member, a spouse, a child, an adult child or something, because I think that does make a difference. And I think to your point, someone that you can trust to go to appointments with you, because you're absolutely right. When you're in that kind of just trying to process everything, there are things that are said that you miss, or things that you may interpret differently. And it really helps to have somebody else that is hearing the same thing and can help you, and then may have other questions that you may not have even thought about to ask. So I think that's important. I think the other thing is, like write down your questions and your feelings, how you
Ahead
feel
of time.
ahead of
Mhm.
time, or even, like when you find out, you may not think of everything then,
Oh,
but then there may be like once you've kind of had a chance to process this, you may have other questions. I write down questions too. So write down, like have a piece of paper or something. And when a question comes, write it down so that then when you go back, you can just rely on anything that you think about that you may not have thought about at the time. Because sometimes as you process it, things come up and you're not going to remember when you go back. So I really encourage people, write down everything that you think, every question that you have, whatever it didn't make sense. I thought I heard this. Is this correct? Write it down and literally take that with you, to the doctor's office, to the
that's
doctor,
good.
to appointment,
Yeah.
so that you can kind of and just go through your list. I mean, I do that and have done that. So I think that's important. And then give yourself permission to feel how you feel. I mean,
If you could speak directly to someone newly diagnosed and overwhelmed about that diagnosis, what would you tell them?
wow. I would say, I think if you're able to find someone that can kind of walk the journey with you, a friend, a family member, a spouse, a child, an adult child or something, because I think that does make a difference. And I think to your point, someone that you can trust to go to appointments with you, because you're absolutely right. When you're in that kind of just trying to process everything, there are things that are said that you miss or things that you may interpret differently. And it really helps to have somebody else that is hearing the same thing and can help you, and then may have other questions that you may not have even thought about to ask. So I think that's important. I think the other thing is,
If you could speak directly to someone newly diagnosed and overwhelmed about that diagnosis, what would you tell them?
wow, I would say, I think if you're able to find someone that can kind of walk the journey with you, a friend, a family member, a spouse, a child, an adult child or something, because I think that does make a difference. And I think to your point, someone that you can trust to go to appointments with you, because you're absolutely right. When you're in that kind of just trying to process everything, there are things that are said that you miss or things that you may interpret differently. And it really helps to have somebody else that is hearing the same thing and can help you, and then may have other questions that you may not have even thought about to ask. So I think that's important. I think the other thing is, if you feel overwhelmed, it's understandable. If you feel like you want to cry, cry. If you feel scared, what's scaring you? Is it the uncertainty, unknown, the fear? And it's okay to feel that way. And then to recognize if you need additional support, like if it's something that's really overwhelming, who else can I talk to? A therapist, a clergy, my pastor, someone else that might help me through that. So don't hesitate to get all of the help you need, because your physical health is one thing, but your mental and emotional health goes along with that. And so, make sure that you're seeking the resources to get that too.
That's important.
Yeah.
I had, you reminded me of a physical I had last year with my primary care physician, and I was armed and dangerous. I had questions because they give you a certain amount of time, and you have X number of minutes. And so I want to utilize that time well. So she's gonna come in and do this, this, this. But when she walked in, I said, "Okay, when you finish, I have some questions. So I just want to let you know." So she did what she needed to do, asked me what she needed to ask me. And then I took out my phone because I had written in my phone. I said, okay, number one.
But that was really a successful appointment because I felt like it was so thorough. I didn't want to waste her time.
I knew I only had a limited amount of time with her. So I was ready, as opposed to times where I've gone and I'm not prepared. So I'm trying to think of, well, now what else do I need to ask? Now, inevitably, you always forget
Right.
something really important. And she can't sit there and wait until maybe it comes to mind.
Right. And I'm telling you, your healthcare providers appreciate that.
She did?
They really appreciate
Yeah.
that. So it's not like, oh, I'm being,
Yeah.
you know, forward or what. They appreciate
Yeah.
that, because
She did.
I mean, at the end of the day, I I believe that the majority of healthcare providers want to provide compassionate care
Mm-hmm.
and they want to provide good care. Otherwise, why would you be doing this?
Right.
And so I think to the degree that you can be a partner in your care and really believe that, because it's you. I mean, it's a partnership. It's not a dictatorship.
Yeah.
It's a partnership. So to the degree that you approach it as a partnership so that you're contributing by coming with questions, by really thinking through, like, if something's going on, what's the best way that I can help my healthcare provider make that diagnosis? So coming, with, like we said, what's the type of pain, all of these things that you can contribute and then provide that, then it really becomes a partnership and your healthcare provider appreciates that because I think the majority of healthcare providers really want to provide good care, and you have to be a part of that.
I think that's so important that you remind us that it is a partnership, or it should be. If we want the best care, the best experience possible, we need to be partners, because they don't know what we're going through on a day-to-day basis. So, like you said earlier, be able to describe that so
Right.
that you can help them help you.
Exactly.
Yeah, we can be partners, and we can. The other thing I'm remembering is the relationship of trust and how important it is for me to feel comfortable that I'm with the right physician or having the right procedure. And if I'm not, I need to take some time and figure that out.
Absolutely. And understand too that sometimes it may not even be a competence issue. It may really be a right fit issue.
Mm-hmm.
Because sometimes it's like,
Yeah.
yeah, you may be great at what you do, but if it's not a good fit, then it's not a good fit. And understand, like I understand there are some areas, even of this state where there's a shortage of providers. So it's not like you have your choice of providers. And so I understand, that is a reality. But I also understand there are other places like the metropolitan Atlanta area, which is where we are, and other metro areas, there's more than one provider. And so it's okay if it's not a good fit, if it's not the right fit. It's okay to say, I need to go to somebody's because at the end of the day, I got to feel comfortable with this relationship, with this partnership, because it really is a partnership. So it's okay to say, this isn't working for me. Right. So I need to feel good about that because I think that's how you get the best care and how your health provider is able to provide the best care.
That's good, Kim. I'm so glad you shared that. Well, you shared a lot of good tips for us from the medical community. I think I can be a better patient now, and I'm sure you can too. Listening audience, so many good nuggets, so much good information that we desperately need in order for us to be our best selves and the healthiest that we can be. And we need to partner. And Dr. Kim explained what that looks like. So let's do it. Let's do it. Because we got to continue line dances. I need to help.
And I think it's so interesting because I can truly say, based on, what I've shared with you in my story, that I know what it is to be a patient. I know what it is to be the healthcare system from both sides, so.
Thank you for sharing such a personal journey with us. That's a lot. You didn't have to do that, but I think it's really helpful for us to know what you've been through and how you navigated that and how we can navigate our own situations when we're faced with those. And inevitably we will be if we haven't been yet. Yeah, so we thank you for hanging in there with us. Hope you gained a lot. I know I did. And we will see you next time on Get Real with Alexis. Take care. Bye
Bye
bye.
bye.